The subject of health has come up a lot of times throughout this conference, and I know you've all been talking about before you got here. So we had a great session on working with health professionals, and it became apparent as we went around the room to ask why people were there that we all were trying to figure out how do you break into the health professions. You know, what language do you speak? Who do you talk to? What kind of bureaucracy do they have? And so that was one of the first places we wanted to start, and then other questions came up too. So we decided to put together a toolkit where we'd answer some of these questions and put together resources for everybody, for all of you, so you could take that out and interact with the health community and get their support, and funding's always nice too, and work together. So in this toolkit, we outlined the following things. One is, as I mentioned first, how to understand your health community. What kind of titles are we looking at for the health community? What areas do they work in? Who should you contact about what? And how are they organized? Both the public health community, also the industries, like the insurance industry and the private entities as well. The second thing was a list of resources that you could use. One example came up, the State Comprehensive Outdoor Recreation Plan that every state puts together has great data in it in terms of what kind of outdoor recreation activities do people like to do best in the state. That's something that's great to quote back to in terms of getting support. It was just one idea. The Heart Association, the Lung Association, lots of great ideas came out, and we'll continue to grow with that. So we'll put together a list of resources. Another one is best practices. What's going on now that's working with the health community? Again, along the nature of this conference, how can we learn from each other and build on what other people are doing, in this case working with the health community, including tips for connecting to the health community. The other one is research. When we talk to people in the health community, a lot of times what we heard was they need data points, they need research, they need sort of the kind of empirical data to help make that case of why to work with us. So what research is out there, and putting together also in terms of, in addition to research, also funding potentials. Or health organizations provide funding. I know in California and maybe other places, Kaiser has been a tremendous support too. And then take all that information and put together talking points. So you can arm yourself with these talking points when you go out and you've now identified what health professionals to talk to, public, private, or nonprofit. You have these talking points in your hand and you can speak their language, you can rattle off all this great data and totally wow them, and they'll just, you know, want to do everything you want. And then the other thing that we thought was really great that people brought up was this idea of prescriptions. And this has already been developed and it can be expounded on, but why not learn from it? Ideas of take a little prescription, like instead of taking, and you can work with your physicians on this too, but instead of prescribing, let's say, blood pressure medication, go out and hike every day. You know, check that off, write it up as a prescription, and then also tell people where to go. Where's an open space area, a park, or a community area where you can go and take this hike. And I know people are starting to do that now, so we're going to download those, make those available. There's a very clever idea of having the Fish and Wildlife Service is doing this, and also a voting group take a pill bottle and put a label on it. Oh, there it is. Thank you, Kathy. There's our visual aid here. Thank you. And put a label on it, and Kathy has them back there, that say, you know, here's a prescription, and for example, side effects. Side effects are joy and happiness, and, you know, family bonding, and all these things that will happen if you go outdoors and play. And it's very clever. And so we can all, you know, again, rather than reinventing this, we can all learn from it. So that'll be part of the toolkit too. So that'll be available for all of you. I don't know about 3 weeks, Richard. We'll do our best.